Well, here's a bit of a shocker. The Congressional Budget Office this weekend estimates that only 2% of Americans under the age of 65 would sign up for a public option for health insurance. That, despite the congressional Democrats arguing strenuously for months that offering a government-run plan would not undermine private insurance carriers.
But that 2% still amounts to about 6 million people who say they would sign up for the public plan. The CBO, a nonpartisan analyst for Congress, also found that the House plan would not overtake private insurance and might actually help people sign up for insurance. And joining us this morning to try and sort all of this out in 5 minutes is Dr. Ellen Shaffer. She's the co-director for the Center of Policy Analysis here in San Francisco. Thanks a lot for joining us. That last statement about how it might help people buy insurance, can you clear that up for us a little bit?
Well, the issue with buying insurance is that it's very expensive, as we know.
Sure.
And the idea of a public option is that it wouldn't have all the administrative expenses and the profit, the executive bonuses that for-profit insurance companies have to build into the premium rate. So a public option plan would be more like Medicare. It would be more affordable and would have the clout to negotiate for lower rates with the drug industry, with hospitals and doctors. So it would make it more affordable for us, for the people who need to get care.
Okay.
Well, so now the Senate and the House both have public options in those bills that were fought against by many sectors. Clear it up for us how each would help and whether folk and why folk need to support it if they do.
Well, the Senate's still writing their bill. The House bill is out.
Right.
But it's still open for some change. We have a chance to weigh in over the next couple of days. There'll be what's called a manager's amendment that Nancy Pelosi and George Miller and Henry Waxman, people we're familiar with here in California, will have something to say about. So the way that public option is written in the House bill is that we could start joining these health insurance exchanges that the public option is part of in 2013, and individuals and small business employees could join it. So one thing is we want it to start sooner. We want to make sure that we can get into this sooner and that everybody can be part of it. Another controversial part of the public option in the House bill is that it would let the public option charge negotiated rates. We want to make sure that what the public option what it pays to providers will be based on Medicare, which now has 40 million people in it and can then get the rates down pretty low. So if the public option can pay Medicare plus 5%, it means they'll be pretty low, that's the Medicare part, but there'll be enough wiggle room, that's the plus 5% part, so the providers will want to take people who are part of the public option and will be able to get access.
Can I do follow-up on that? Because that is where the insurance and others are arguing that if you're paying Medicare rates, doctors can't survive, hospitals can't survive, so they put on those added costs onto a private insurance, and that's why they're so high. Our costs of our private insurance is so high.
They're saying that. I think that the idea is if we can get everybody into the system, because that's the other reason that our costs are so high, so many people can't afford to get insurance at all. We're changing the equation. We're making sure now that everybody's going to be paying in. Employers are going to be paying in. We're going to be paying in as individuals. So there will be many more people in the system, but we're going to be also putting a brake on the costs. Private insurance plans will be able to follow the trajectory that Medicare sets out in terms of paying providers less. We'll be able to help insurance companies basically follow what the public option does and what Medicare does, so that they will also have more negotiating clout with providers.
With all with this new information that only 2% of Americans would sign up for a public option, we've heard so much about controversy about this public option. Is it worth the 2%?
It definitely is. I mean, we need to have the precedence there. We need to have the option for people to buy something that will be more affordable. And I think it's very hard to tell at this point whether there will be 6 million more people in the plan or 30 more people in the plan. Again, remember, we've got 40 million people on Medicare, and that has a very important effect on the marketplace. If we have 6 million more people in the public option, that certainly will help, but it's hard to tell. Many more people can join it if it is, in fact, more affordable and has good benefits.
When all is said and done, do you see these measures passing?
I think that they will, and I think that because they're probably going to pass, it really is important for us and the public to speak up, to make sure that we're watching these bills every step along the way, and that we're getting the provisions in the bill that will make it more accessible and affordable for those of us who desperately need care.
But the belief is that the public option is going to be fairly watered down, so others say, well, at least it's a first step. At
least it's a first step, and of course, we will have the option in the state to try to look to something like a single-payer system.
The Kucinich bill that you mentioned?
The Kucinich amendment would make it easier for us on the state level in California, Pennsylvania, New York. A lot of states are looking to the next step in this effort to really make health care affordable and accessible. The Kucinich amendment, which we hope they will put, it passed in the House once, we hope the managers will put it back in the bill this week, would make it easier for us to proceed to single-payer without the threat of lawsuits from another federal law called ERISA, which only the Congress can amend. It says the federal government is the only entity that can legislate employee benefits, employee benefit plans. We want to change that and make sure that we can't hold up single-payer bills on the state level because of that law.
So you're saying we, but what you're saying is the public needs to weigh in, and they need to do what?
The public needs to call the Speaker, Nancy Pelosi, the important committee chairs here in California, George Miller and Henry Waxman, and tell them we need a strong public option, and we want to see the Kucinich state single-payer amendment put back into the House bill when they introduce the manager's amendment this week.
Thank you for joining us.
Well, as we said, it's complex.
Real pleasure. Yeah, thanks very much.
It's very, very difficult to get our arms around, but we keep trying.
Absolutely. We have to do it.
We'll be right back.